I note the publication of this Health Regulation of Termination Amendment Bill 2023 and very much welcome the opportunity to speak to the issues raised. It's particularly appropriate, as has been said before, that the debate this evening is taking place on the 5th anniversary of the repeal of the 8th Amendment, something that I and many others here worked hard on. As colleagues will be aware, when I was appointed Minister for Health, I made it clear that we needed a revolution in women's healthcare. We weren't looking for things to get a little bit better each year. Our ambition has been to move much faster than ever before, to make up for the decades of underinvestment and indeed to make up for the decades of under-provision of healthcare services for women. Our aim is to provide new services and financial supports. These cover important areas like menopause, gynecology, endometriosis, contraception, maternity services, breastfeeding, perinatal health, both physical and mental health, and fertility. To that end, we've invested in women's health services in this government in a completely new way and at a completely new level. In the budget for last year, I ring-fenced €31 million for new developments in women's health care, and the budget for this year saw an additional allocation of €70 million. By next year, the full year impacts of the last 3 budgets will see, before we add any new development funding for next year we'll have an additional €150 million in the base for women's healthcare services. And I know from talking to women around the country, from talking to clinicians around the country, the impact of that is being felt. It is making a big difference. As colleagues will be aware, as part of this work later this year, we're extending free contraception to women aged 16 to 30, and we'll be introducing state funding for IVF for the very first time as well. In the context of this evening's debate, I'd like to take the opportunity to reiterate my own commitment to ensuring the termination of pregnancy services can be accessed quickly, that they can be accessed easily by those who need to use them, and critically, that they can be accessed without judgment or without bias. And this includes colleagues introducing legislation later this year establishing safe access zones around termination of pregnancy services. As deputies are aware, the 2018 bill was signed into law on the 20th of December 2018, and expanded termination of pregnancy services have been available from the 1st of January 2019. The Act allows terminations to be carried out in cases where there's a risk to the life or of serious harm to the health of the pregnant woman, where there is a condition present which is likely to lead to the death of the fetus either before or within 28 days of birth, and without restriction up to 12 weeks of pregnancy. This is in line with the recommendations of the Joint Oireachtas Committee on the 8th Amendment to the Constitution, which published its report and recommendations in December of 2017. Prior to the referendum in May 2018 to repeal the 8th, the general scheme of the bill was published. The final legislation enacted is consistent with the published proposals such that it reflected the will of the people who were voting to repeal the 8th. Initially, I think it's important to acknowledge the progress that has been made in the rollout of the service to date. As the report quite clearly lays out, there is a lot more work to be done. But it must be remembered that the service is of relatively recent duration, having been in operation for just over 4 years. And for much of that time, as we're all aware, it's been functioning under the constraints of the COVID pandemic. But notwithstanding these difficulties, it has embedded well into the wider health sector, and there has been an acknowledgement within the report that many of the services, that there's been a lot of progress made in rolling out these services. However, as I said, it is recognised that challenges remain. I acknowledge that regardless of the report. We knew there were challenges before the report was completed. But the report is a really thorough, detailed and useful piece of work in pointing out a lot of the operational challenges. My department is fully aware of these issues and is working closely with the HSE and other relevant stakeholders to expand services. To ensure the service is performing as it should be and in line with statutory and government commitments, I commenced the review of the Act at the end of 2021. The review was based on independent research and it comprised 2 phases. The first phase was an evidence and information gathering exercise which consisted of a public consultation and research into the operation of the Act from the perspective of both service users and service providers. The public consultation provided organisations, stakeholders, advocacy groups working in the area and all other interested parties provided them with the opportunity to have their say, to have their input on the operation of the legislation. And believe it or not, nearly 7,000 submissions were received as part of that consultation process, a very thorough consultation process. Research to inform the service user strand was carried out by Dr. Catherine Conlon. Dr. Conlon has completed a large qualitative study investigating unplanned pregnancy and abortion care. The study, which was commissioned by the HSE's Sexual Health and Crisis Pregnancy Programme, has generated an in-depth understanding of the experiences of women who have accessed abortion care services since the commencement of the Act. The study was published in July of last year. Research into the views and experiences of service providers was carried out following a tendering process by Manchester Metropolitan University. So that was the first phase. The second phase then of the review was led by an independent chair, Ms. Marie O'Shea. Ms. O'Shea assessed the extent to which the objectives of the 2018 Act have been achieved. She analysed the findings of the 3 strands of work from the first phase, and the chair also drew on findings of other relevant peer-reviewed research and consulted further with stakeholders as necessary before providing conclusions. The final report was submitted to me on the 28th of February of this year, and I'd like to take the opportunity to thank Marie O'Shea and to thank all of those who contributed to the review for their dedication and input into the important work. There will be debate about the various measures. Tonight is a good example. There will be a lot of discussion. But one thing I imagine we can all agree on is it was very detailed work, very thorough work, and certainly from my perspective, there's a lot of very useful detail, feedback from service users, service providers in terms of improving the services. The report makes a wide range of recommendations. Most of these are operational in nature, and then there is a relatively small number which would require or are proposing legislative change. The review was comprehensive. It included a wide range of perspectives on termination of pregnancy services, and consequently I think it is important that we accord the recommendations in the final report due consideration and due deliberation. The report was considered by Cabinet on the 25th of April. I recommended to Government that the HSE establish an implementation group to progress the operational recommendations, and that the report, particularly concerning the legislative proposals, be referred to the Joint Committee for Health for their consideration. Government has agreed with these recommendations. The HSE group is being established, and the report is now with the Joint Committee on Health. Now, I said that I'm particularly interested in the Health Committee's views on the legislative recommendations, but obviously the Health Committee is of course free to consider anything it wants, including all of the operational recommendations, and may well have views itself on the operational recommendations as well. In relation to the proposed legislative changes, it is recognised that they require careful consideration and careful discussion. These matters are not just for Government, these matters are for the entire Oireachtas. Given the committee's cross-party composition and oversight role in relation to the health service, the Health Committee, I believe, represents an effective and critically an appropriate forum to consider the changes proposed. It's important to allow the Joint Committee on Health the time and the space its members need to complete their deliberations before proceeding with any potential legislative change. In the meantime, can I say to colleagues that regardless of the Health Committee's recommendations, regardless of the debates we have here in the Dáil or indeed in the Seanad, regardless of any Government recommendations or decisions, I am absolutely focused on continuing with improving the services. There's an awful lot that can be done in parallel with any legislative change, whether there is legislative change or not, and indeed the extent of that legislative change. As colleagues will be aware, we have 19 hospitals in the country with maternity units. Only 11 of those are currently providing termination of pregnancy services. That is not acceptable to me. I don't believe it would be acceptable to many of us here. The very clear goal is that all 19 of those hospitals provide the services required, and there is a lot of very useful detail in the report around making that happen. But I want to assure colleagues that I'm working directly with the HSE and the National Women and Infants Health Programme, who are leading out of this, to make sure that all of the barriers to implementation across all 19 hospitals are identified and addressed. Similarly, colleagues will be aware from the report that there are over 400 GPs providing services. That's a large number, particularly coming from zero at the when the legislation was passed. Nonetheless, the report quite rightly points out, and colleagues have already alluded to it, that there are parts of the country where there's very sparse provision. So one of the other things I'm doing is, again, working with the department, the HSE, the National Women and Infants programme, and indeed the representative bodies for the GPs and the GPs themselves, to make sure that we understand what's required to have more and more GPs provide these services. So I fully respect the debate that's happening tonight. I fully respect that this will be an ongoing debate in terms of legislation and operation. I just want to assure colleagues that regardless of any of that debate, there is a health service that is already provided for under law, and that health service needs to be available right across the country. A lot of progress has been made. There is a lot more progress we need to make. And so in parallel with the debates we'll be having here in the Oireachtas, I will continue to be working closely with the HSE, with the department, to make sure that the services as already provided for under law are provided to the greatest extent possible. I'll also be progressing the safe access zones legislation for the reasons we all understand as well. Gur Mágad.